Joining us now in studio is Meg French. She is the Director of International Advocacy and Programs for UNICEF Canada. And I was going to say welcome, but we're neighbors.
We are.
I didn't even know that. You guys are in this building.
Yep.
UNICEF
Just next
Canada.
door, actually.
You're right next door.
Yeah.
Okay, so
Made the trip over easy.
it was easy to get here. Good. Meg, 2 weeks ago, UNICEF and the World Health Organization announced that the Millennium Development Goal on water was being met, had been met actually by the end of 2010, 5 years ahead of schedule, and this was one of the first targets to be met. So let's find out what this actually means. How many people worldwide now have access to improved drinking water sources?
So as of 2010, 6.1 billion people, which at the time was about 89% of the population. The target goal was 88% to be reached by 2015. So we've surpassed that goal, and at this rate, we will have well surpassed it by the time we get to 2015.
Can you tell over the last couple of decades how many more people have access than before?
Yeah, that means 2 billion people now have access to improved drinking water sources than did before. When you account for population growth, when you're looking at building the proportion of people with access to safe water, you also have to take into account population growth, and so we've really seen some great progress.
And if it's 6.1 billion as of 2010, the original target was 2015, what do you anticipate the real number you'll hit by 2015 will be now?
We suspect that we'll see about 92% of the world's population with improved drinking water sources.
92% of the world's
Yeah.
population? That sounds pretty good.
It is. It's great. It's wonderful. It's something we should be celebrating.
How'd you get there?
So it would have taken a global effort. It's a global goal, it's a global target. And so what that means is that really efforts from a number of different groups. On one account, it would have been the effort of donor countries like Canada, who provided funding to provide this kind of water, clean water to families, to women, children, and men around the world. So that's an important piece of it. Also, the role of governments, national governments, local governments, municipal governments, to really put in place the policies needed to implement those drinking water sources, to dedicate the funding from their budgets for it, to build the capacity amongst the civil service, to provide that kind of improved water as well. So that was really critical. The work of UN agencies like UNICEF, other NGOs, civil society organizations who help train, who help build capacity, and who also put in water sources themselves, so be they pumps, boreholes, that sort of thing. And then communities played an important role, because without the demand from communities for clean water, governments are just less likely to put in place all the things they need to get there.
So in essence, the world decided to make it a priority, and it happened.
Exactly.
I want to better understand what it actually means now. Does this mean that in 88% of the world now, you turn on a tap and clean water comes out?
No.
That's not what it means.
That's not what it means.
Okay.
Because when we talk about improved drinking water, it can be a variety of different kinds of water. So it can be piped in tapped water. It could also be water that comes from a covered well. It could be water that comes from a borehole where you've got a pump and you pump the water up. So it doesn't necessarily mean a tap, but it does mean water sources that are the safest water sources we know of. And the other side of that no is that what we're at, the 89% we're currently at, isn't equally distributed around the world. There are parts of the world that have seen progress more quickly than other parts of the world. So while globally we've met that target, if you start looking regionally or even at country levels, there are still countries that are behind and regions that are behind.
I'm not sure people realize this, and I certainly didn't before looking into this, but when you have access to clean water, it means a whole lot of side compounding benefits as well, like more girls go to school. Yes. Connect the dots for us.
Sure. So it's not just a glass of clean water. It is, for instance, when we talk about education, in many places, they're girls' responsibility, women and girls, it's their responsibility to go and get the water for the family. And so if that water isn't close to home, then they have to walk half an hour to go get that water, and maybe multiple times a day. And so that getting water for the family is prioritized over going to school. So if you can move the water source closer to either into the house itself or even to the schoolyard, for instance, then you've got girls who go to school and can get the water at the same time, or their parents can go get the water because it's closer to their community. So that's an important piece of our education goals as well.
And extrapolate again, safe, clean drinking water also is better for the economy as a whole because?
Better for the economy for a whole because people aren't as sick. We know that if you drink unclean water, you're much more likely to get things like diarrhea. For adults, that means time off from work, from being able to earn a living. And so if we can ensure people are healthier, we can ensure that they don't miss out on opportunity to work. It also means healthier children as well. And so diarrhea accounts for about 3,000 deaths a day of children under 5. And we know that clean water and sanitation could avert 90% of those deaths. So it's really important that we get access to clean water to children. It also stops them from going to school too. If they're sick, they're not going to school either.
I want to hit that on the head again because that's shocking. 3,000 children today will die from causes related to diarrhea.
Yes.
From diseases related to diarrhea.
Yes.
Why are we still in a position where, despite the positive information we got at the beginning of this interview, there are still so many people who don't have access to safe water?
Well, we're still there because, because the disparities I talked about, the differences if you break down the numbers. So places like sub-Saharan Africa are not on target to meet the water goal. And partly that has to do with you've got a lot of the least developed countries there. So they were at a lower point to begin with in 1990 when we started measuring this goal. So there were a lot more people who needed to get access to water in that country than in other places. There have been conflicts in some of those countries, which if you've got a war going on, it's hard to also be working on implementing safe water sources at the same time. And then on top of having more people who needed water to begin with, also those countries tend to have the greatest population growth as well. So they're constantly chasing that number as the population grows.
Let's also remember that we're talking so far about access to good water. We haven't talked about the quality of the water, the reliability of that access, and the sustainability of the water as well. By those metrics, how are you doing?
So that we're not as clear on. The measure for this Millennium Development Goal was access to improved sources of drinking water, which is a proxy indicator, a substitute indicator that we use, where we look at sources that we know to be safer, but we haven't actually measured the quality of the water in all of those sources. So we know if a water source is generally covered, it's going to be safer than if you went to a lake and dipped water out of a bucket of water out of the lake. And so we're really looking at and working on how can we better measure the quality of water for one. So what are the cheaper, simpler tests that can be done so that you can have a better measure of the quality of water to make sure it's safe? And also what can we give to families so that they can do household treatment of their water where they're not sure of the quality of the water? So that can be things like chlorine drops in the water, or ceramic filters. If you pour the water and it filters through a ceramic filter, it can clean the water. In Cambodia, UNICEF worked with some local artisans to produce ceramic filters for water filtration, and we studied the effectiveness of those filtration systems and saw a 40% drop in the incidence in diarrhea when those were used. So it builds a local market, and it also helps address health concerns at the same time.
That sounds easier, faster, cheaper than a multi-million-dollar filtration plant or something, is it?
It is.
It is, okay. Look over my shoulder at the monitor there. I want to share, so these are your numbers, so you probably know them already. UNICEF numbers on the success rates of this around the world. 90% of people living in Latin America, the Caribbean, Northern Africa, and large parts of Asia have access to improved water supply sources. 61% of people living in sub-Saharan Africa have access to improved water supply sources. More than 40% of all people globally who lack access to clean drinking water live in sub-Saharan Africa. And as you just indicated, for all of the reasons we just talked about, give us a sense about what's being done to help those people.
Okay. So One of the things there is that we've seen that if you look at sub-Saharan Africa as a whole, they're not meeting the target. We do know that there are some countries that are meeting that target, countries like Malawi, and others where they had so far to go are not going to meet the target, but are really improving the levels of the numbers of people with access. So countries like Rwanda. But there's still much to do. And what we're seeing here is that these are the people who are the most difficult to reach. It's not where the low-hanging fruit isn't there anymore. And so we're really looking at what are the innovative ways we can get water to people. So for example, in about 20 countries in sub-Saharan Africa, we're looking at manual drilling of boreholes. So in the past, you would come in with a giant machine and it would dig a big hole in the ground and you'd put a pump on top of it. It's costly. If you're living up a mountain in a jungle, how do you get that machine up there? And so there are other possibilities on how to bring water to the communities there. And so manual drilling is one of those ways of doing it. And what's great about manual drilling, and UNICEF Canada is supporting a program in the Democratic Republic of Congo where we're working on this, is that we train local people to be able to drill the holes manually, to cover them, to put the pumps in place. We provide them with the startup supplies that they need. And then they can then go around to communities in their area, drill the holes, provide access to water, but then the skills are also there to maintain those pumps. And so you've built a local industry on top of providing access to clean water.
Now, the drinking water is only one part of the equation. The other part of the equation is sanitation.
Yes.
How are you doing on that front?
Not nearly as well. We had much farther to go, for one, but we're also seeing there are still approximately over 2 billion people who don't have access, about 2.5 billion people who don't have access to basic sanitation. And by basic sanitation, we're talking about latrines, toilets that separate human feces from human contact.
Is it all the same part of the world we've been talking about?
More or less, you see a huge portion of people who don't have any access to basic sanitation actually live in South Asia. So we have a lot more progress to make there. And they're very much tied together, because if you don't have good quality basic sanitation in place, it has an impact on your water source.
And do we presume that you went after the drinking water first because that's the easier goal to achieve? This is going to be a harder one, a harder nut to crack?
We didn't go after them one after another. We've been working on them simultaneously.
But the target for this one, the Guardian says the target on this one's not going to get hit for another, how's my math here, 14 years.
Yeah. And it won't. I mean, we were going at them simultaneously. The sanitation target is just a harder target to reach. It has a lot more to do with behavior change as well, what people are used to in terms of where they go to the washroom, washing their hands, all of the sanitation and hygiene practices that people have been using for centuries.
I can just tell in the way we're talking about this right now, it's not a comfortable subject to discuss. No. And I wonder if that's, I mean, is that part of the battle you have to fight?
That's definitely part of it. And you know, for a while as an international community, we were hesitant about calling a spade and talking about it as it is. But increasingly, we know that that's what we've got to do. We have got to just be very upfront about what happens if you go to the bathroom outside near a water source. And we've got to work with young children to bring about those messages to their families. So they learn about it at school, and then they go home and they say, at school, they just put in a latrine. Why don't we have one at home? And so those are important lessons as well.
Rich and poor is obviously one dynamic. Urban and rural, is that another dynamic here?
It is another dynamic. Urban populations are much better off than rural populations, both for the water target and the sanitation target. In the sanitation target, for instance, there's about 2.5 times as many people in rural populations who don't have access to basic sanitation than do in urban populations. I mean, urban populations are easier to get at. They're not as spread out. If for water, you can link them into pipe systems if necessary. All of that is much more difficult in a rural setting.
And Meg, just in our last 30 seconds here, if rich and poor is one of the clear dynamics going on here, is it fair to say you can't really make enough progress on these issues if people are still poor? Eradicate poverty, you'll eradicate these problems of drinking water, sanitation, and so forth.
Yes. I mean, we talked about earlier about the interconnection between water and education and health. Well, the same thing has to do with the interconnection with poverty and water and sanitation. These Millennium Development Goals really need to be looked at as a whole. And so while we celebrate the successes we've achieved, we also have to make sure that we're not forgetting the places where we still need to be working harder.
Understood. Meg French from UNICEF Canada. It's good of you to visit us here at TVO today, a whole whopping 100 yards from your office. Thanks so much.
Support Ontario's public television. Donate at tvo.org.